We are beginning to see the real-world implications of the ending of the Affordable Care Act enhanced subsidies as hospitals have reported greater numbers of uninsured people showing up at their emergency rooms as well as their clinics. Now, this is because for many for-profit hospitals, July is the time they start reviewing their Q2 earnings, and many of the executives of these hospitals have expressed great concern about the rise in uninsured patients. So what exactly is going on here? Well, with the ending of the Affordable Care Act enhanced subsidies at the end of 2025, nearly 90% of enrollees on Affordable Care Act marketplace plans saw their premiums increase by about double on average. And this means that for a lot of enrollees, they have to choose between food and health insurance, right? Which is not an easy choice to make at all. So many enrollees chose to drop their health insurance coverage. In fact, as of early 2026, enrollment in the Affordable Care Act marketplace fell by about 2.6 million people, which is about 12% of the individuals that received these Affordable Care Act enhanced subsidies. And nearly half of this 2.6 million people who are newly uninsured are young people between the ages of 19 and 34, which isn't at all surprising and gives great concern that because young, cheaper people to insure are unenrolling from plans, it's going to create this snowball effect that in subsequent years will make these Affordable Care Act plans more expensive. And so what this means is you have a greater proportion of Americans, because they are uninsured, who are only seeking out care in emergency situations, right? Instead of receiving preventative care from specialists or their primary care provider, they might have an accident or they might have a chronic disease that gets worse and worse and then seek out care in a hospital's emergency room. A lot of patients choose to seek out care in an emergency room even though they can't themselves pay for it because of a federal law known as EMTALA, which says that even if patients can't pay, they don't have the ability to pay, the hospital legally must take in that patient from the emergency room and stabilize them. And so when a lot of these for-profit hospitals have been releasing their earning reports, and this has also been corroborated with nonprofit hospitals, they are saying that there is an increase in uninsured patients by about 20%. And the reason this is such an issue is because for these hospitals who are required to treat these patients, they are essentially operating at a loss. Now, I know we don't like to think about healthcare like a business. However, if a hospital is losing about $1 billion in operating profits per year, when we worry as health economists about whether or not that hospital can continue to function financially or whether it would be required to close. And especially for the hospitals that protect and treat the most vulnerable populations, people of color, people in rural areas, a hospital closure can greatly affect the health and well-being of that particular population. In addition, the increase in uninsured patients due to the ending of the Affordable Care Act enhanced subsidies and the subsequent profit loss of these hospitals might mean that even if you have insurance through your employer or somewhere else, your health insurance costs might rise because the hospital, trying to make the numbers work, negotiates with that insurance company a higher rate, which can subsequently increase your premiums, your co-pays, your deductibles. Now, I hate making videos like this because this is something that when I was talking about the ending of the Affordable Care Act enhanced subsidies last year, I was very worried about. The fact that we are seeing all of these spillover effects from the ending of the Affordable Care Act enhanced subsidies onto hospitals, onto patients, onto people who don't even have health insurance coverage through the Affordable Care Act enhanced subsidies is greatly alarming. And it just goes to show how all of the different mechanisms of our healthcare system, how unsustainable they all are, especially given this current political and economic environment. And I hate making videos like this because aside from just offering policy solutions like expanding Medicaid, for example, or creating a universal healthcare system, that's not really a solution in the sense that this current administration and this current Congress don't seem to have the appetite to do it, at least right now. And that, I know, at least for me, is incredibly frustrating to have to make these videos for you all to try and educate and inform you and then not have a solution at the end. And I'm so sorry about that. It's very frustrating. But for now, that's all I got. As always, if you have any questions, let me know.